My name is Neha Sharma, and I am the dental director of MCHC Clinics. My role here has been phenomenal, and because I stepped up from being a dentist to a dental director in just 4 years, so it was a huge leap in growth. And I would count it towards my success. I love coming to work every single day, and why I love coming here is just the best feeling that you get when you care for and serve the population that needs you the most. I definitely would not be able to do it alone. It is teamwork. It is with the help of our assistants, who even bend over backwards to do things for our patients. We all together, the providers and our team, we call ourselves the MCHC family because there are other departments too. We strive towards a common goal, which is the wellness of our patients. In dental, we definitely believe that the overall health of our patients is the priority. We want them pain-free, we want them smiling. We cover counties, almost 4 to 5 counties, including Mendocino, Lake, Humboldt, Sonoma. We see patients all over. We're open to taking patients with toothache visits where they cannot get into other counties, other offices. We are always recruiting too. We are looking into new providers and new staff. We like to recruit from a local Mendocino college program for our assistants, and for providers we look all over, including the H-1B category visa holders, as well as people who are nationals here. And we have a great program that you can apply to for loan repayment. So all in all, I would say patient-wise, staff-wise, provider-wise, I think I would not be happier in any other place but here. We mostly do bread and butter dentistry. So we are doing fillings, cleanings, extractions, root canals, and crowns. We do dentures for our adult patients. We do a lot of kids care, and if we need to refer them out, we have our particular, like if they have to be put under or if they need nitrous, we have places we can send them. We are also bringing nitrous on board, where we will be using it for kids under 6 to start with. For procedures that we do not do would be impacted molars, which is the wisdom impacted molars. We also refer out for molar root canals, and for anything that is too fancy, which would be implants or bridges. So those are the things that we do not do here.
One of the biggest things here for dental, there's a huge need for dental services in all of our surrounding counties. It's not just Mendocino and Lake County. I actually get patients coming all the way down from Del Norte and Humboldt County calling to get in just for a dental emergency. They can't be seen at the community, the county that they're living in, because there's no resources up there for them, or they're not seeing adult patients. So we're lucky enough that we can get them in here at one of our clinics to take care of their dental emergencies. And I think that I pride myself in making sure our patients are being seen, especially if they're having a dental emergency. We want to get them in, we want to get them out of pain, and we want to keep them out of the emergency room is our main goal. A lot of the different clinics, they have stipulations on, what they can do, and they're limited with their resources. So for us, we don't want to deny access to any patients trying to get in and be seen, and especially if they're in an emergency state and they need to be seen. We don't like to turn patients away. So we will get them into our clinic to get them seen with one of our dentists, whether it's at 1 or 3 of the sites that I manage. So and I think they feel relieved when they call us and say, oh my gosh, thank you so much, you can actually get me in. I want people to treat me the way I want to be treated. And I think if you show them kindness and you treat them with respect and you treat everybody like they're family and let them know that you're here for them and you want them to move up, I don't hold any of my team members back. I want them to grow within the organization. And if it's not within the organization, come and talk to me. What can I do to help you to get you to where you want to go? I think one of the nice things about working here in this clinic is that there's so many different job opportunities, and I don't think anyone has ever held me back. They've always encouraged me, hey, apply for this position. Hey, why don't you take this on? You'd be great at it. So getting that support is huge because I've never had that in some of the other jobs I've had. So I've always told my team, I said, I wish I would have known about the clinic years ago. It would have saved me a lot of jobs and a lot of training I had to do, but this one has been by far my favorite.
Well, for me, I had a practice in San Francisco. I graduated in 1976, so I've been doing this a while. But I wanted to get out of the city. It was about 2000, around the 2000 time. And I had heard about a house being up for sale in Lake County, and so I came up and I looked at it, and I just loved it. And it was actually owned by Andrew Dorfman, who was a physician here at MCHC. And I ended up buying the house, and he told me to, he suggested that I go ahead and apply to the clinic, because it's so close and, it's a really great place to work. He enjoyed it. So I did. Finally, after I bought the house, 6 months later, I interviewed with somebody here, and it worked out really well. I still had my practice in the city, so I was still working there, but I ended up here 2 days a week on Thursday and Friday. It was a bit of a commute back and forth, but I loved being up here and I loved the house that we bought. And so we did that for a while until I finally retired from San Francisco in 2016 after 40 years, and then I came up here and worked 4 days a week at the clinic. And I've really enjoyed it. I've always enjoyed dentistry, and I like the mix of people that we see up here. It's different than the city. We see kids and old people and everybody. And I find that people really value what we do here. They're appreciative of the fact that we are available to treat them, and the staff has been great. I really enjoy getting up and going to work because it's really fun working with the staff, and the patient mix is great. And I've been doing this a long time, so the dentistry part of it is pretty easy. I had a lot of experience doing that, from dentures to fillings to extractions to exams. Dentistry is evolving quite interestingly, and keeping up with that and going to courses is really fulfilling. And I find there are easier ways to treat patients. There are better filling materials that are quicker, and the anesthetics are better. I work a lot with relaxation, especially with kids. I find them very available to breathing exercises, believe it or not, just simple breathing exercises, breathing and relaxing, and it just gets them out of their head, and they can relax, and it's a practice that's good for any stress relief in general. So I find that really interesting, and a lot of times we can, not always, but a lot of times the kids will just start relaxing, and then we can do the work on them much more efficiently, quicker, and they end up grateful for it, believe it or not. Not so scared to go to the dentist the next time, perhaps. It's been great working with this clinic, working with this organization. They have very good equipment, and they keep expanding, getting better and better at treating patients, and that's been very rewarding for me. Even though I've been doing this now, I don't know when I'm going to retire. But for right now, it's been really good, and I really am appreciative of the staff. Here in Lake County, there's a mix. There's people that have been here a long time, people that have been born here, raised here, And then people that have come here, like myself, from the cities and looking for a more rural setting, more laid-back country life. I remember reading an article in the San Francisco Chronicle, and it was entitled "Laid Back in Lakeport." And it was really interesting. It was talking about people that come up here to get out of the city, to kind of get into a more rural and relaxed setting. And the things that the area offered, you know, a lot of winery now, a lot of winery businesses coming in. And then the people are just, it's a mix of more people that have been raised here and new people that have come in, children that have been raised here, and children that have come in. So it's in all ages, and we see them all here at the clinic. So we get an opportunity to serve a lot of different kinds of people. But I find the thing that gets to almost everybody is just being available and listening to what they have to say, so that you kind of understand where they're coming from, and they appreciate that. They appreciate being listened to, and you go from there and you actually address whatever issues they have first. And you do the exam, you figure out what they need, and then from that point of view you can discuss with them what you could do for them. So that's very rewarding. Even though all different kinds of people show up from this county, we can treat them and give them something of value that they value. So that's very rewarding. Living up here is much quieter. You sleep better. There's no distraction from city noises and traffic and that sort of thing. Nature is really beautiful up here. You get seasons, the changes of the seasons, and it's just the people are more relaxed up here. I don't feel like there are as many complaints. You know, you go out and you can talk to people, you can meet people, and there's just a much more relaxed kind of vibe up here. It's been great working with this clinic, working with this organization. That's been very rewarding for me.